Hello guys. Uh, Here we will be discussing a question which is being asked like many times on different forums and which is confusing a lot of students. So that is why uh, I thought that I should make this video, and that is related to the premature loss of the primary molars. Well, the deciduous molars, they are quite frequently lost due to caries and the pulpal involvement. At times only a part of deciduous molar is lost, and that is due to caries. And if it is not restored timely, there would be some deleterious effects on the developing occlusion. Though deciduous molars, they are themselves the best space maintainers till their natural exfoliation. And if they are pulpally involved, the first thing we should be doing is saving the tooth by different pediatric endodontic procedures, which we will discuss in a separate video. In case they need to be extracted, then space maintainers must be provided if there is a substantial time left in the eruption of succedaneous teeth. Well, if space maintainers are not provided timely, or the space maintainers they fail due to any reason, then the consequences would be quite negative on the developing occlusion. In those cases, teeth they will move mesially, as well as they may over erupt, and there will be definitely some bad effect on the occlusion, as well as space is going to be lost. The difference between the deciduous canines and the deciduous molars, their total sum, mesiodistal distance, and the mesiodistal distance of permanent canines and the premolars, which are part of the permanent dentation, that difference is called leeway space. No matter it is in the maxillary arch or it is in the mandibular arch. Well, in the mandibular arch, the leeway space is slightly greater as compared to the maxillary arch. In contrast to the anterior teeth, the premolars, which are part of the permanent dentition, are smaller than the primary teeth they replace. The mandibular primary second molar is on the average 2 mm larger than the second premolar, while in the maxillary arch the primary second molar is 1.5 mm larger. The primary first molar is only slightly larger than the first premolar, but does contribute an extra 0.5 mm in the mandible. The result is that each side in the mandibular arch contains about 2.5 mm of what is known as leeway space, while in the maxillary arch it is about 1.5 mm at an average. When the second molars are lost, the first permanent molars they move forward, which means mesially, quite rapidly. So we can say mandibular molars they move at a greater distance and quite rapidly using the leeway space. Whereas both arch length and arch circumference they decrease. These are related and commonly confused terms, but we will discuss these terms in a separate lecture. Well, over here, this case, which is confusing a lot of people. So this is the situation, a patient who is 7 years old. So in 7 years old, we will be seeing all the first permanent molars, they would have been erupted. PM, permanent molar. and now the mandibular permanent incisors would have been erupted as well. Usually at this age, the permanent maxillary incisors would have erupted, but the deciduous incisors, they would be still present. Deciduous canines in both the arches and deciduous molars would be present, but as we have told in that question, a patient who is 7 years old is missing upper right deciduous second molar and lower left deciduous second molar. But the space maintainers were not given to that patient. Now this is the situation. This is the current situation. When patient visits you and when all the deciduous molars are lost and the first permanent, like first premolars, they have been erupted. Second premolars are still, they have to erupt, and definitely as the time has passed, some of the space would have been lost. So in maxilla on the right hand side, since the space maintainer was not given, the space lost is almost 5 millimeter, minus 5 millimeter. And where both the deciduous molars, they were present at that time, the space left lost is 3 millimeter. Similarly, in mandible on the right hand side, both the deciduous molars, they were present. So the space lost is only 3 millimeter. But on the left hand side, the second deciduous molar was missing for quite some time and space maintainer was not provided. Hence the space which is lost is 4.5 millimeter. Now, question is asking what is the actual space loss. I will go back to this picture here where the permanent molars, both the deciduous molars, they were present. The space lost is 3 millimeter. Similarly, in the mandible where both the deciduous molars, they were present, the space lost is 3 millimeter. But where the deciduous molar was missing, there is an additional amount of 2 millimeter space lost. So that is the actual space lost in maxilla. And over here, the in mandible, where the deciduous molar was missing, the space loss is 4.5 millimeter, which is 1.5 millimeter greater than this space loss. So what is happening? The actual space loss over here, this is going to happen by any means. Additional space loss is 1.5 millimeter. Hence, we can say that the actual space loss is 1.5 millimeter. That is the additional space loss in mandible. Now the question is asking whether it is 8 millimeter in the maxilla, 5 millimeter in the maxilla, 7.5 millimeter in the mandible, or 1.5 millimeter in the mandible. Our answer will be 1.5 millimeter. But if the question would be asking about the maxilla, then it will be 2 millimeter actual space loss in maxilla. Good. So this is the answer. Thank you very much for watching this video, and I will be coming back to you. I will be getting back to you with other problems. I will try to solve whatever your queries, whatever your problems are with these type of videos. Thank you very much.